What's your opinion on algorithm-driven social media scrolling, and especially in today's environment?
That's a really important question,
Yeah.
and it just reminds me. When I was applying for residency, I approached a mentor of mine who was a neurologist,
Mhm.
and I asked for a recommendation letter. And she said, "Why do you want to go into psychiatry?" And I remember saying to her, "Because psychiatry is not an algorithm-based specialty." And she said, "Well, neurology isn't either, right?" Which just goes to show that there are algorithms in medicine, there are algorithms in research, right? But it's also important that we are able to think outside of the box, not only when it comes to, practicing medicine in the clinic, but as you mentioned, social media based algorithms. I mean, if we're just looking at how do we get from point A to point B to point C, then we might be missing some of the nuances there
Yeah.
in medicine. Another thing I'd like to say, just when it comes to being a clinician here, if we're only focusing on algorithm-based practices, imagine I see a patient who's struggling with depression, and I know that the next best step to help this patient get better is to recommend an SSRI,
Mhm.
selective serotonin reuptake inhibitor, like escitalopram, Lexapro. But for whatever reason, this particular patient does not want to take an SSRI or doesn't want to take a medication in general, right? So if I'm just stuck on the algorithm, depressed patient, this is what I'd recommend. They're saying, no, I don't want to do that. I could easily say, well, since this is outside of the algorithm, this is someone I can't help.
Yeah.
That's not the case,
Yeah.
right? So that's where we really have to sort of think outside of the box, break away from some of those algorithms. And I have to ask myself as a provider, okay, what are some other evidence-based options that might help this person?
Mhm.
And that's when we go into some of these discussions about nutrition, breath work, mindfulness, spirituality.
Yeah.
And that might offer a bridge back to some of those algorithm-based practices like the SSRI.
And I feel like thinking outside the box, that's where a lot of innovation even comes from.